everyone, my name is Denise Amaro, and I'm going to be discussing to everyone about our standard precautions and transmission-based precautions, also known as isolation precautions. I'll be informing everyone the proper way how to use your PPE, which is personal protective equipment, also to carry out such safety precautions. Okay. We'll also be talking about the different types of isolations and the different types of germs and infections you should use. Okay. First thing we're going to be talking about is standard precautions. You want to use standard precautions with every patient regardless of diagnosis or suspected infection. Okay, you always want to carry out good hand hygiene. Use soap and water, of course. When you enter a patient's room, you always want to wash your hands before entering. You want to wear some gloves. That way, if you have to come in contact with the patient, you'll have your hands protected with gloves from any germs. Once leaving the patient's room, you want to dispose of your gloves inside the patient's room. You never want to leave the room with the gloves still on. You always want to wash your hands after you exit the patient's room, of course with soap and water. Now, you don't have to use it when they're not on isolation. You don't have to use soap and water once you exit. You could just use some hand sanitizer is fine as well. Okay? When you have your PPE, you want to wear this. That's going to be your gloves right here, your gloves, your gown, and some protective eyewear. That way if any body fluids splash or anything, you always want to have everything protective. Alrighty, we're going to be talking about our different types of isolation and transmission-based precautions now, okay? Alright, your transmission-based precautions, you always want to carry those out with your standard precautions. There's just some extra steps required for these. Of course, you always want to have, it's for goodness gracious.
Stop.